We are here at Vascular Center of Naples with Dr. Becker, and we are learning a convenient way to remove varicose veins. Dr. Becker, as a vascular surgeon, what exactly do you do and what makes your office special?
Well, here at the Vascular Center of Naples, we tend to specialize in everything vascular. We do some surgeries for stroke prevention with the carotids. We treat aneurysms in the heart, in the belly. We treat peripheral arterial disease with blockage in the legs. But what we like to focus in today on is our treatment for varicose veins. This is a very common problem, more common with females. The more children you have, the more likely are you to have varicose veins. It's not usually something that's debilitating to the point that you can't function on a day-to-day basis, but it does affect your everyday activities to the point where at the end of the day your legs feel heavy, fatigued, sometimes swollen. And you've seen people with big varicosities and spider veins. In worst case scenarios, you can even break out to be ulcers that are very painful and very difficult to take care of. And so we here at the lab do some vascular studies to document what veins are leaky and which ones are not leaky. And when we're talking about leaky veins, we're really talking about the valves in the veins that all our veins have, and they're supposed to slam shut like little trap doors. So as blood flows past those and gravity pulls down when we're sitting or standing, they're supposed to slam shut. For various reasons, like we talked about, they become stretched out and leaky, allowing blood to go backwards. And that leads to just general aches and pains and heaviness and fatigue and swelling, and again, worst case scenario, ulcers. So once we document it, which veins are leaky and not leaky, then we know which ones we can treat and which ones we can't treat. There's a bunch of different options for treatment. One is stockings, compression stockings, which don't allow the blood to back up, forces it into the leaky vein. One of the other procedures that we do that's more definitive treatment is the ablation, where we burn that vein shut. Everything done through a small incision. Done here as an outpatient in our office. Have it done, takes about 30 to 40 minutes. Go home the same day. The only restrictions, really, we just don't want you to be too active for about a week and no submerging underwater for about a week also. But by and large, you're back to usual activities the same day and full activities in a week. Here you can see on the ultrasound, we're checking to see if there's any reflux. And you see how the bolus of blood shoots through the vein and then immediately the valve shuts. Compare this to a vein where the bolus of blood shoots through the vessel and then the valve continues to leak and leak and never shuts until way out here. Again, normally it should shut around this area. So this is what we call venous insufficiency, where the valves are not working. So if you're ready to live your life without varicose veins and the fatigue, heaviness, varicosities, and spider veins, come into our office at the Vascular Center of Naples for a free screening, or look at us on our website at vascularcenternaples.com, or quickly give us a call at 239-431-5884. Thank you.